Dear members of the media, buenos días, todos. By the way, I like the word vamos, vamos. That's the most frequent when the three ministers were leading this operation in style, and that's why I said Spain led in style. And let me begin by thanking Prime Minister Sanchez and his government for Spain's outstanding leadership and partnership over the past week. I would also like to thank Minister Monica Garcia, my sister. Of course, now I'm introduced to two more ministers who have been working closely, Minister Fernando Grande Marlaska and Minister Ángel Victor Torres. It seems incredible that it was only 10 days ago that WHO was first informed of a cluster of cases of Hantavirus aboard the MV Hondius. Under the international health regulations to which Spain is a party, as His Excellency said, countries are required not to allow people to be stranded at sea when they have the capacity to manage the risk safely and responsibly. At the time, the ship was near Cabo Verde, and I asked Prime Minister Ulises Correa e Silva to assist with evacuation of the three symptomatic passengers on the ship, which he did. However, WHO's assessment was that the situation exceeded Cabo Verde's capacity to handle the full disembarkation and repatriation. So last Monday, I wrote to Prime Minister Sanchez asking if Spain would accept the ship and manage the disembarkation of the passengers with support from the World Health Organization. By the way, European Union's assessment was also the same, and Prime Minister received the same request from European Union. And he responded immediately in the affirmative. And for the past week, Spain and WHO have worked together closely, of course, under Spain's leadership, along with the government of the Netherlands and the ship's operator to coordinate and execute the operation that took place over the past 2 days. I thank Prime Minister Sanchez not only for meeting Spain's legal duty under international law, but also for exercising his moral duty to show solidarity with compassion, kindness for the passengers on the ship. Especially during these difficult times, the world needs this kind of kindness and compassion. And that's exactly what Spain did, and we're so proud to witness that. And I know the whole world is proud to witness that. The world, I repeat, if there's one thing it needs at this time, is kindness and compassion and support each other, apart from, of course, the legal obligations. We can say confidently that this phase of the operation was successful. As you have heard from Prime Minister Sanchez, all of the passengers have disembarked and left Tenerife. And MV Hondius, the ship, is now on its way to the Netherlands. Almost 150 people from 23 countries were on this ship for weeks in what must have been a very frightening situation. Even some of the passengers were facing mental breakdown. They have the right to be treated with dignity and compassion. There were some people around the world calling for the passengers to be contained on the ship for the full quarantine period. Our view was that would have been inhumane and unnecessary. Yesterday, during our presser, I called it even cruel to suggest that. We were convinced that it was possible to disembark these passengers in a way that was safe for them and the people of Tenerife, and that was respectful of the human rights of the passengers and crew. Over the past week, I have also been in regular contact with the ship's captain, Jan Dobrogowski, and I would like to thank him, the crew, the company that operates the ship, the CEO, Mr. Remy, and all of the passengers for everything they have done. I fully understand why the people of Tenerife may have been concerned about passengers from the cruise ship disembarking on their shores. We said the risk was low, both to the people of Tenerife and globally, and all our efforts over the past week have been aimed at keeping it low. This is a serious situation, which we have taken and continue to take very seriously. A WHO expert boarded the ship in Cabo Verde and was joined by 2 doctors from the Netherlands and an expert from the European Center for Disease Prevention and Control. And WHO's assessment continues to be that the risk to her health globally continues to be low. So far, 11 cases have been reported, including 3 deaths. All 11 cases are among passengers or crew on the ship. 9 of the 11 have been confirmed as Hantavirus, and the other 2 are probable. Those numbers have changed little over the past week, thanks to the efforts of multiple governments and partners. There have been no deaths since 2nd of May, when WHO was first informed of the cluster of cases. All suspected and confirmed cases have been isolated and managed under strict medical supervision, minimizing any risk of further transmission. At the moment, there is no sign that we are seeing the start of a larger outbreak. But of course, the situation could change. And given the long incubation period of the virus, it's possible we might see more cases in the coming weeks. Each of the countries to which the passengers have been repatriated is responsible for monitoring the health of those passengers. WHO is aware of reports of a small number of patients with symptoms consistent with Hantavirus, and we're following up on each of those reports with the respective countries. WHO's recommendation is that they should be monitored actively at a specified quarantine facility or at home for 42 days from the last exposure, which is the 10th of May, which takes us to the 21st of June. Anyone who becomes symptomatic should be isolated and treated immediately. Our work is not over. WHO will continue to work closely with experts in all affected countries. We have also requested countries to report regularly to WHO on the health and well-being of passengers and crew through the international health regulations. Once again, WHO expresses its deep appreciation to Prime Minister Pedro Sanchez and the government of Spain for its outstanding leadership and partnership over the past months. As I have said many times, viruses do not respect borders. Our strongest immunity is solidarity. And that's the solidarity that Spain has demonstrated. It gives me great comfort, and there are still people in our world who do things not because they're politically expedient, but simply because they're right for the people of Spain and the people of the world. Muchas gracias, Your Excellency.
Y ahora pasaríamos a las preguntas, Alex.
Muchas gracias. Empezamos con las preguntas con Sandra Gallardo, de Radio Nacional de España.
Good morning, Dr. Tedros. Some questions on behalf of the Spanish press in Spanish, if I may. Presidente, usted ha calificado de exitosa esta operación. Una vez concluida, me gustaría saber si ha echado en falta más cooperación por parte del Gobierno canario, si considera que ha sido desleal el presidente Clavijo poniendo objeciones desde el primer momento. Y, doctor Tedros, presidente Sánchez, ¿qué pensaron, por curiosidad, qué pensaron ustedes cuando escucharon hablar al presidente canario como argumento de ratones nadadores? Y, presidente, si me permite preguntarle por otro asunto, la presidenta Ayuso, la presidenta de la Comunidad de Madrid, acusa a su gobierno de ponerle en extremo peligro durante su viaje a México. Gracias.
Bueno, muchas gracias por sus preguntas. Desde luego no vamos a entrar en ningún tipo de polémica institucional. Yo me quedo con dos cosas que he dicho en la introducción a esta rueda de prensa. En primer lugar, las palabras del Papa, León XIV, expresando su reconocimiento y su admiración a una sociedad, la sociedad canaria, que ha dado ejemplo de solidaridad, de empatía y, en segundo lugar, también al conjunto de la sociedad española, que ha asistido a todo este operativo con absoluta tranquilidad y con absoluta confianza en el despliegue operativo, en los profesionales sanitarios y en la capacidad que tiene nuestro país, que es uno de los pocos países en el mundo que en cuestión de horas es capaz de desplegar un operativo para garantizar una respuesta ejemplar y eficaz ante una crisis de emergencia o de salud global como hemos vivido o estamos viviendo en relación con el Hantavirus. En segundo lugar, sobre la presidenta de la Comunidad de Madrid, tampoco quiero polemizar con alguien que es profesional en crear problemas y en confrontar no solamente en nuestro país, sino, como hemos visto durante estos días, también fuera de nuestro país, en este caso en México.
Yeah. Thank you. Yesterday in the morning, the ship that was going to move on to the Netherlands, the Hondius, was refueling and also doing other things in preparation for the... So we had some window where we were not busy in repatriation. So I had a chance to work in Tenerife. Physical exercise is important. So on daily basis, I try to achieve around 10,000 to 11,000. So I started walking in the street. I was alone, actually. And a few people recognized me. And the kindness I have seen was amazing. I just walked. I didn't have any problem to really walk in the streets. And because what I expected was exactly the kind of reaction that I encountered, is kindness and appreciation of what the government is doing and what WHO is helping with. So I walked actually 2 hours, which is exactly around 12,000 steps. And I found Tenerife to be, it's not just the land or the beauty of the city, but the kindness from the people and the way they treated me, which is more important, by the way. The beauty of the land is not the land, it's the people. And I even, to one of them, he encountered me, I said I will come back with my family to have, sometime in Tenerife, because it was my first time in Tenerife, but this was not the way I wanted to be in that place, actually. So I will hope to come back and visit and have time with these kind people. Many didn't trust me when I said I walked for 2 hours, but I did. And it was very, very enjoyable and very kind and there was no issue except full support. I think that's how I would always remember, although difficult times too, but I would remember the kindness and support we get from the islanders and the understanding. And so one of them actually said they're proud that they're doing this because these passengers need kindness and love actually, from all of us, from the rest of us. And no one wants to be in that situation. If you imagine for a minute how it would feel if you're trapped in a ship. Thank you.
Continuamos con Victoria, Agencia Reuters.
Hi, thank you. I have two questions for Dr. Tedros. One of them is about the tracing of the passengers who had disembarked the ship before the hantavirus was detected. I believe it was 34 passengers. I wonder if you could tell us if all of those passengers have now been located and traced, and what the protocol is for them. Will they be tested or quarantined? And a second question about the Dutch medical staff who are now being quarantined because they didn't follow the new protocols that were put in place when the passengers were brought into the hospital in the Netherlands. What can we learn from that case to make sure that it doesn't happen in other hospitals as passengers are brought in? Thank you.
As far as we know, I think the passengers who disembarked have been located, and including one actually in the remotest place, and the UK had managed to reach through very difficult operations. And they're following up and also communicating with us. And the second question, of course, we should learn from this operation what has been done well and what were also the weaknesses identified, because there should be a constant learning, and change should be a constant, improvement should be a constant, and I know countries see it that way. And that's why, by the way, based on COVID lessons, we're trying to improve the system. Several initiatives that we have started, including the pandemic agreement, by the way. But there are many other initiatives based on COVID lessons. And we can also learn from this and update and also recalibrate and prepare the world for, the better.
Telecinco.
Sí, buenos días. Muchas gracias al doctor Tedros. Estos días estamos viendo tantos protocolos de seguridad como prácticamente países están involucrados en esta crisis sanitaria. Me gustaría saber si esa diferencia de protocolos que se están aplicando es un motivo de preocupación desde su punto de vista. Y al presidente Sánchez, enganchando de alguna manera con las respuestas que le daba a mi compañera Sandra, me queda la duda si cree usted que es necesario, tras la conversación que tuvo usted el pasado jueves con el presidente canario, con el presidente Clavijo, si cree que es necesario conversar de nuevo con él para intercambiar impresiones, dado que él sigue insistiendo en que su gobierno tenía razón a la hora de decir que había que reducir incluso más los riesgos. En otros asuntos de actualidad nacional me gustaría obtener su opinión, presidente Sánchez, sobre una imagen que contemplamos ayer en la celebración del Barça, en la rúa del Barça. Vimos al jugador Lamine Yamal ondeando una bandera de Palestina. Lamine Yamal, como todos sabemos, es un referente con muchísima influencia, muchísimos seguidores, y me gustaría conocer su opinión sobre ese gesto que hizo el jugador del Barça. Y en último lugar, si me permite, el caso Mascarillas ha quedado visto para sentencia. Me gustaría saber cómo ha asistido usted al desarrollo de ese juicio y una reflexión sobre unas palabras que pronunció el fiscal anticorrupción al decir que la corrupción estaba carcomiendo la democracia. Son palabras que el fiscal anticorrupción dijo en el marco de un juicio a uno de sus exministros. Me gustaría saber qué reflexión tiene que hacer al respecto. Y muchísimas gracias a los dos.
Yeah, okay, we'll start. On the safety protocols, of course, WHO has a clear guidance, and countries are expected to follow or to use. But at the same time, countries, based on their own assessments, they can make some adjustments because sometimes their local situation could may need some adjustments. On the other hand, there is also the sovereignty, not only not only the adjustments based on local situations, but they have the sovereignty, so we can't force them to take our protocols. We can only advise and recommend, but I hope they will follow the advice and the recommendations we're making. Thank you.
Pues muchas gracias, Iñaki, por sus preguntas. En relación con la primera, nosotros encantados de seguir hablando y conversar y dialogar con una institución tan importante como es el Gobierno de las Islas Canarias, para el conjunto de la sociedad canaria y también, lógicamente, para el conjunto de la sociedad española. Pero sí quiero, de nuevo, resaltar, subrayar el reconocimiento explícito que ha hecho nada más y nada menos que el Papa a la solidaridad y a la empatía del pueblo canario, que evidentemente desde el Gobierno de España nos sumamos a ese reconocimiento, a ese agradecimiento, y recordar al conjunto de la sociedad española que el Gobierno de España lo que ha hecho ha sido seguir su manual de gestión de crisis que hemos también desplegado durante todos estos años, donde hemos tenido que hacer frente a crisis innumerables de todo tipo. En primer lugar, el rigor científico y, por tanto, el asesoramiento técnico. Todas nuestras decisiones se han basado en ese rigor científico y en ese asesoramiento técnico. Y quiero reconocer, además, la profesionalidad y la calidad de todos ellos. En segundo lugar, la transparencia absoluta en la información. Ha estado, gracias además a los medios de comunicación, en conocimiento de los ciudadanos, nada más ser, digamos, gestionado y conocido por parte del Gobierno de España, por tanto, absoluta transparencia. En tercer lugar, lealtad institucional y, finalmente, la cooperación internacional, que hemos hecho a través de la Organización Mundial de la Salud, pero también con más de una veintena de países y, lógicamente, también con las instituciones comunitarias, que también agradezco su reconocimiento que hicieron explícito tanto la presidenta de la Comisión Europea como el presidente del Consejo en el día de ayer. Sobre la cuestión de Palestina, bueno, España ha reconocido el Estado de Palestina. España, desde el primer minuto, condenó los atentados de Hamás y, acto seguido, ha condenado el genocidio que se está perpetrando por parte de las autoridades israelíes en la Franja de Gaza. Y, por supuesto, también la ocupación ilegal que se está haciendo a través de asentamientos en Cisjordania. Y creo, y además lo he sostenido en multitud de ocasiones, que esta guerra hace mucho más inseguro a Oriente Medio, hace mucho más inseguro también a la propia sociedad israelí y que, por tanto, es tiempo de cumplimiento del derecho internacional, de acabar con la guerra, de dar un horizonte político de coexistencia pacífica entre Israel y Palestina. Y eso pasa no solamente por el acceso a la ayuda humanitaria, también por el fin de la impunidad y por el reconocimiento de un Estado de Palestina, como también se ha reconocido por parte de España la existencia del Estado de Israel. También Palestina tiene todo el derecho a existir, como hemos defendido también cuando hablamos del Estado de Israel. Y finalmente, sobre la última de las cuestiones, lo he dicho en muchas ocasiones, es el tiempo de la justicia y el Gobierno lo que ha hecho ha sido colaborar con las fuerzas y cuerpos de seguridad del Estado y con la justicia.
Muchas gracias. Terminaríamos con Shenan Bolelli, de la agencia Anadolu.
Hola, buenos días. Shenan Bolelli, agencia Anadolu. Dos preguntas para el presidente Sánchez, el director general también. Primero, sí, bueno, hace muy poco tiempo nadie conocía Hantavirus, ahora toda Europa conoce. Si después, próximas semanas, habrá más casos de Hantavirus, ¿quién será responsable políticamente después que el barco ha llegado a España? No sé, ¿qué opinión tenéis sobre este tema? El segundo, sobre Palestina. No sé si habéis hablado ustedes entre vosotros hace poco, porque en Granja de Gaza ha sido objeto de intensos ataques y destrucción por la parte de Israel. La situación sanitaria ha llegado a punto crítico. No sé si la Organización Mundial de Salud y también el Gobierno de España sobre este tema de salud en Palestina quiera dar algunos pasos más. Gracias.
Gracias. Si quieres, Tedros, intervengo yo primero y cierras tú la rueda de prensa, ¿no? Yo creo que el director general de la OMS ha sido claro en su exposición. Los responsables políticos de los viajeros son los gobiernos ahora mismo de cada uno de esos países y, por tanto, lo que estamos haciendo, al menos lo que le puedo decir desde España, es monitorizar la evolución de los pasajeros de ese crucero que están ahora mismo en el Hospital Militar de Madrid del Gómez Ulla. Sabe que el protocolo que hemos establecido en España son 2 PCRs, una que se acaba de hacer y creo recordar, ministra, que la siguiente dentro de 7 u 8 días. Y en función de eso, los especialistas pues, nos irán indicando exactamente cuáles son las medidas que tenemos que tomar desde salud pública para garantizar su propia salud y también, lógicamente, la salud del conjunto de la sociedad española. Por tanto, como ha dicho antes el doctor Tedros, no ha acabado esta crisis y el Gobierno de España continúa siguiéndola muy de cerca y monitorizando cada uno de los pasajeros, también, lógicamente, los asintomáticos. Y respecto a la situación humanitaria en Gaza, nosotros hemos dicho 3 cosas. La primera es que se tiene que garantizar el acceso total a la ayuda humanitaria a la población gazatí, que desgraciadamente hoy no se garantiza ese acceso total. En segundo lugar, que se debe respetar ese alto el fuego y que las partes se tienen que sentar para dar una solución política que inevitablemente pase en el medio plazo por el reconocimiento del Estado de Palestina en una coexistencia pacífica con el Estado de Israel.
Yeah, thank you, Your Excellency. On more cases, as I said it in my speech, we would expect more cases because, as you may remember, the index case, the first case in the ship was on April 6th. And until the report was confirmed as infectious, that's around April 24 or 25, there was a lot of interaction actually with the passengers. And as you know, the incubation period is also 6 to 8 weeks. So because of the interaction while they were still in the ship, especially before they started taking some infectious prevention measures, because of the interaction, we would expect more cases because of some of what happened during the travel, actually, until, hopefully, the interaction until April 30th. After that, of course, they have improved the measures. But the second part is passengers now have left and they're in their respective countries. So as Prime Minister said, the countries are taking responsibility and all the measures are being implemented by countries. Of course, as previously asked, earlier question, there are differences from country to country. This could be because of local situations. But at the end of the day, the countries actually take responsibility. And I hope they will take care of the the passengers, helping them to the best they can, and also protecting their citizens as well. That's what we expect. On Palestine, of course, there is improvement in access, improvement in medical evacuation. We do medical evacuation as well. But still, it's not as what one would expect, especially not full access, as Prime Minister indicated. So we need full access. For instance, if you take the number of trucks that should cross to Gaza, the number of trucks should be average 600 per day, but that's not happening. So I think there should be improvement on that, and the amount of aid that the Gazan residents need should be delivered on daily basis. The 600 trucks are actually the indicator. The other problem is when the number of trucks increase a good number of them are commercial, but many of the Gazans actually can't afford even to pay. So we have to make sure that those the tracks who cross actually, by and large, are humanitarian ones, so people can have access to the humanitarian support. So there is improvement, but still not full access, and still there are challenges. And as you also know, because of the destruction of the infrastructure, the hospitals, the health system literally collapsed. So that's another problem, rehabilitating that and making sure that the people who need service are getting service is our priority. But still, with the level of distraction, access to health services is minimal. So with that, thank you so much. Glad to have this opportunity. And again, I would like to thank Spain, and especially Prime Minister Pedro Sanchez, for the outstanding leadership and coordination. I know this is a model, and I hope other countries also learn from this, not just the obligation part, but the compassion and solidarity that Spain has shown. And I repeat again, in this divided and divisive world, which is in a very dangerous trajectory, I think what's important is kindness and taking care of each other. So thank you again for your leadership, Your Excellency. Very proud of Spain and very proud of you. Thank you.
Muchas gracias.